Hello, this is Professor Hale. Now we're on to part 6 in chapter 37 of nephrotic syndrome and glomerulonephritis. I'll also be covering nephrosclerosis. I didn't list it here, but we're covering now. So nephrotic syndrome is a kidney disorder that causes your body to pass too much protein in your urine. Nephrotic syndrome is usually caused by the damage to the clusters of the small vessels in your kidneys that filter waste and excess water from your blood. The condition causes swelling, particularly in your feet and your ankles, and increases the risk of other health problems. So in nephrotic syndrome, large amounts of protein, like I said, is lost in the urine from an increased glomerular membrane permeability. And as a result, serum albumin and total serum protein are decreased. So normally the albumin and other serum proteins maintain fluid within the vascular space, but when levels of these proteins are low, fluid leaks from the blood vessels into the tissues, resulting in edema. With very low levels of protein, ascites, and massive widespread edema, anasarca, which is another word for that, occurs. In response to a low protein levels, the liver produces lipoproteins, and as a result of serum cholesterol, low density lipoproteins and triglyceride levels are elevated. Urine may appear foamy from the lipoproteinemia and a loss of immunoglobulins that may cause increased susceptibility to infection. And also elevated blood pressure occurs. In addition, here are the nephrotic syndrome some signs and symptoms. You're going to have a tachycardia, severe swelling, edema, particular around your eyes and ankles, as we said. You're going to have foamy urine as a result of excess protein in your urine, weight gain due to fluid retention, fatigue, and loss of appetite. The treatment is to control edema, and by doing this is diuretics that may be used, and sodium intake may be restricted, prevention of infection, daily weights, and an INO measurements and abdominal girth measurement. So nephrosclerosis. Hypertension damages the kidneys by causing sclerotic changes in the small arteries and arterioles, such as arteriosclerosis with thickening and hardening of the renal blood vessels, which is nephrosclerosis. Arteriosclerotic changes in the kidney blood vessels result in a decreased blood supply to the kidney, which is ischemia of the kidney, and which can eventually destroy the kidney. So the remaining nephrons try to compensate with a vasodilation to increase blood flow to the glomeruli, but this results in increase in glomerular pressure and filtration, which thickens the blood vessels. High pressure in the kidneys causes the vessels to weaken and hemorrhage. Large areas of the kidney will become damaged. Symptoms of nephrosclerosis include proteinuria, hyaline casts in the urine, and as it progresses, symptoms of chronic kidney disease occurs. So the treatment for nephrosclerosis is to control the hypertension with medications. The patient is placed on low sodium diet. Dialysis may be required. The prognosis is poor. By the time the patient develops nephrosclerosis, there's a widespread of arteriosclerosis throughout the body, and arteriosclerosis make the patient prone to myocardial infarctions, MIs, or cerebral vascular accidents. So the priority nursing diagnosis that is relevant when the patient develops nephrosclerosis is ineffective health maintenance, and the goal is to help the patient manage the hypertension, and the patient should be taught the signs and symptoms of chronic kidney disease to report. So glomerulonephritis is an inflammation of the tiny filters in the kidneys. The excess fluid and waste that glomeruli will remove from the bloodstream exits the body as urine. Glomerulonephritis can come on suddenly, acute, or gradually, or chronic. And glomerulonephritis occurs on its own as a part of another disease, as lupus or diabetes. Severe or prolonged inflammation associated with glomerulonephritis can damage the kidneys. And treatment depends on the type of glomerulonephritis that you do. Many conditions can cause glomerulonephritis. Sometimes the disease runs in families, and sometimes the cause is unknown. Factors that can lead to inflammation of the glomeruli include the following conditions: infectious disease that can directly or indirectly lead to glomerulonephritis. These infections include post-streptococcal glomerulonephritis. Glomerulonephritis may develop a week or two after from a strep throat infection. Children are more likely to develop post-streptococcal glomerulonephritis than are adults. So also they are more likely to recover quicker than adults. Autoimmune diseases are illnesses caused by immune system attacking healthy tissues. Autoimmune diseases may cause glomerulonephritis include lupus. It is a chronic inflammatory disease. Systemic lupus erythematous can affect many parts of your body, including your skin, joints, kidneys, blood cells, heart, and lungs. And then Goodpasture's syndrome. It is a rare disorder also known as anti-GBM disease. The immune system creates antibodies to the tissues in the lungs and kidneys, and it can cause progressive and permanent damage to the kidneys. Vascular disorders are also contribute to glomerulonephritis, could be a cause. Signs and symptoms is oliguria, hypertension, electrolyte imbalances, edema, which is periorbital edema, ascites, flank pain. You can have an elevated BUN and creatinine. And complications from glomerulonephritis affects the ability of the nephrons to filter the bloodstream efficiently. So the breakdown in filtering results in accumulation of waste or toxins in the bloodstream, poor regulation of essential minerals or nutrients, loss of red blood cells, and loss of proteins. Possible complications of glomerulonephritis includes acute kidney injury, chronic kidney injury, high blood pressure, and nephrotic syndrome. Diagnosis is usually a urinalysis, which you're going to find red blood cells or white blood cells and protein in the urine, elevated BUN and creatinine, ultrasound, X-rays, or biopsies are diagnosis to diagnose glomerulonephritis. And therapeutic interventions treatment usually resolves spontaneously within a week. Kidney disease treatment, which is fluids, either antibiotics or antihypertensives or diuretics. Nursing care, you want to obtain vital signs, symptomatic support, make sure that they have enough rest, fluids, sodium, and protein restrictions, diuretics, and client education. So in client education, complete full course of antibiotics, you want to monitor weight daily and report increase to the provider. Adhere to diet and fluid restrictions, and perform basic infection control practices such as hand hygiene. So care after discharge is consider home care services and continue dialysis for plasmapheresis if needed, and follow up with the provider as directed. That's it.